here's a little picture which explains something about the sunlight and how we try to deal with that. Sunlight has UV light, ultraviolet light, which are certain rays that we call in a certain way radioactive. They can go and penetrate the skin and go into the center of the cells, causing mutations and in this case damage to the DNA, which results in fast growing and reproduction of the cells. With sunscreen, what we try to do is make those rays bounce off the skin without causing damage. Studies have been done, and now we know that SPF factor, which is sunproof factor, everything above 15, you can see that on the label of every sunscreen, gives you about 93% of protection. That means of 100 photons, which is the particle of sunlight, 93 will bounce away and only 7 will enter, which actually it's a huge reduction of harm to your skin. But obviously the higher you use the sunproof, so that means going from a SPF 15 to an SPF 30, it will protect better. But if you're gonna use one, at least start with a SPF 15. And nowadays there are even SPF 100. It is, they go very similar to 100% of protection. I don't think they can actually go exactly to 100, but something very similar. While I was doing this presentation and I started reading certain things, I discovered while I was actually looking for this images, that there is like a rumor that sunscreen causes cancer. And I couldn't believe what I was reading, because they said certain of the chemicals that are in the sunscreen are actually the ones that are causing skin cancer. Well, now we have done research about it, and that is not true. Those certain chemical products that are in sunscreen are also in soaps, shampoos, and they do have certain relationship with cancer, but not with skin cancer. And now, of course, those products are being taken away. So now probably the sunscreens that you buy are gonna be paraben free, which is a substance that was kind of worrying people and certain others. So please use sunscreen. It's safe to do it. The risk of actually getting cancer from using it, it's totally I mean, it's very, very low compared to the benefit you're gonna receive. What to do, obviously, check your skin all the time. Try to do it regularly. We think we do it, but sometimes we don't have time, or I don't know, but just do it. Look at your skin, your shoulders. I mean, naked in the bathroom, right in the mirror. Try to do it. Check your feet, check your armpits, places you don't usually check, but do it, because I mean, the key is doing it on time. Obviously the mouth, I mean, we don't check our mouths very frequently, so try to do it with a mirror while you're brushing your teeth before you do it, or after if you want. That's a recommendation. Now there are several apps. I'm not gonna say one in particular, but there are several smartphone applications that you can actually use to track, not diagnose. This is very important, because nothing in an app or here in a webinar, it's intended to be diagnostic, just as a guideline for what you should do. But if you have one mode that it doesn't seem to be like right, or it's suspicious, the apps take pictures and they track the borders, the color, the size, and they give you recommendations. Take one picture in 1 day, in 2 days, in 5 days, and it will track the changes, and somewhere it will actually tell you, well, this is something you should get checked. And obviously the pictures are something that are very good for us doctors to see. Like, hey doctor, this is the way this mole was a month ago, and now this is the way it looks now. So I would recommend to do it. Mm, that image seems to be in the wrong place, but it's not. Using barrier protection, it's very important, because like I was saying, human papillomavirus, it's one of the risk factors for oral cancer. So there is oral sex, so that image is in the right place. I would recommend to do it. Um, and definitely, if you think something's wrong, go to your doctor to get that spot or that sore in your tongue checked.